like many of these debates, it's a false premise, but it allows you to explore the issues surrounding trials and their relevance to clinical practice. So it's quite a nice format. But nevertheless, often in these circumstances, the answer is very obvious. What's the difference between a randomized trial where you're fixing the dose and the patient doesn't get a choice, and you often don't know what the dose is, compared to using the drug in everyday clinical practice, prescribing it, asking the patient if they've got side effects, documenting everything. So arguably, from my perspective, because I've got the easy question to answer, of course, everyday clinical practice is more relevant to treatment than clinical trials. But without the clinical trials, of course, you wouldn't have the drug to treat. So they're both essential. And we want to make the trial as easy to do as possible so that you get hopefully some sort of useful data, but you also end up with a drug that either is clearly appropriate for licensing or is not appropriate for licensing. And, mostly by the time you get to regulatory trials, the phase 3 studies, you already know that the drug is going to work because you've been doing less sophisticated trials with it, and you've looked for side effects on different doses. And so you're a fair way to knowing that this is going to be a useful drug. How useful? That will only be necessary to once you've actually finished looking at the regulatory trials and then get on to clinical practice. And I think everybody should do trials on their own patients and publish them. Most people are too busy to do that. And so they rely on people like me to do it for them, which is fine, and I'm not complaining. But once you have the drug available, and you need to know how to use it. So what we're doing here is Jackie French is talking about how the trials are relevant to the use of the drug, and I'm talking about it would be much more appropriate to actually use the drug in clinical practice to get the information that you need to hopefully go forward with the drug over the next whatever number of years that it's being used.